Pre-weaning, we have to assess the readiness to wean, neurological assessment, cardiovascular stability, hemodynamic stable, blood pressure, good pulse rate, nutritional status, and good psychological readiness. Weaning of mechanical ventilator start reducing FiO2 based on ABG's result and O2 saturation. بنبلش ننزل بالتدريج لل FiO2 ممكن يكون 80% بننزله ل 70% هي مقدار الأكسجين الذي يعطى للمريض. PEEP reduction until less than 5 cm ممكن يكون 10 بننزله ل 5 بننزله ل 2. When FiO2 weaned less than 2.4 أو 40% and PEEP أقل من 5 then the actual weaning may begin. Graduate support and SIMV and pressure support. When SIMV rate reach 4 to 6 we can change the C to CPAP. يعني إذا ال SIMV respiratory rate المحطوطة على SIMV تحولت ونزلناها إلى 4 على 6 والمريض still have good auto saturation good ABG's result ممكن نحول المريض على CPAP. Change CPAP mode or to T-tube TPs. Continuous assessment for the patient physical and psychological response. Monitor patient spontaneous breathing for rate and adequate tidal volume. Pressure support is good for weaning mood for those with neuromuscular dysfunction, COPD, and limited cardiac reserve with limited cardiac output and reserve. Method of weaning TPs CPAP trials. TPs trial consists of alternating intervals of time on the ventilator with the interval on spontaneous breathing. يعني مرة على باستخدام التي بيس على الفنتليتر ومرة على spontaneous breathing إنه يتنفس المريض لحاله. Patient is removed from the ventilator and a T-shaped tube is attached to endotracheal tube أو tracheostomy. One end of this tube is attached to an oxygen flow meter and the other end is open. يعني من حرف التي هذا واحدة بنوصلها ب oxygen flow meter مصدر الأكسجين والثانية بتكون open. The amount of oxygen used is ordered by the physician. Pressure support. Weaning with the pressure support alone consists of placing the patient on a pressure support mode at level that allows the patient to achieve spontaneous tidal volume of 10 to 12 milliliter per kg. Pressure support give a positive pressure posts that help the patient overcome the work of breathing, the resistance toward breathing. During weaning, the level of pressure support is decreased by 3 to 5 millimeter mercury as long as the patient maintains desired tidal volume. Successful weaning is being at 24 hours without distress إنه المريض كمل 24 ساعة من دون أي تعب تنفس. After successful weaning, close monitoring is required. لا airway patency and the oxygenation and ventilation ممكن نعيد له ال ABGs للمريض. Autotherapy is indicated to correct hypoxemia when internal and external respiration is impaired, to decrease the work of breathing, decrease the myocardial workload, and used in many diseases like asthma, COPD, acute lung injury, ARDS, pneumothorax, pleural effusion, and after surgery like lobectomy and among patients with CAD. Patient assessment. The need of oxygen depends on the disease process and the severity of hypoxemia. Assessment for level of consciousness, vital signs, nail bed color, airway patency, autosat, and ABGs. Also, the use of accessory muscle and abdominal breathing may indicate severe distress, and this may indicate the need for oxygen. Signs for improvement: reduction in respiratory rate, increased autosat, decreased work of breathing, improved ABGs, and improved level of consciousness. oxygen delivery system, high flow system like nasal cannula that provide 100% auto saturation. Low level of nasal cannula or low flow of nasal cannula. The 1 liter may provide 21 to 25% FiO2, 2 liter provide 25 to 28%, 3 liter 28 to 32%, 4 liter 32 to 36%, 5 liter 36 to 40%, 6 liter 40 to 44%. Face mask. The face mask provide 5 to 6 liter 40%, 6 to 7 liter 50% oxygen, 7 to 10 liter 60% FiO2. The face tent خيمة الأكسجين low flow device variable FiO2 21% up to 50% and depend on the patient breathing. قديش المريض بتنفس بياخذ أكسجين. لكن claustrophobic feeling associated with the traditional mask. Venturi mask low flow device auto delivery is constant especially among patients with COPD لأنه احنا بدنا نتحكم بكمية الأكسجين especially عند هذول الناس لأنه الأكسجين توكسيسيتي وبصير يعتمد على الأكسجين ممكن يصير في أكسجين توكسيسيتي. 4 لتر من 25 ل 28%، 6 لتر 31%، 8 لتر 35 ل 40%، و10 لتر 50%. Non-rebreathing mask also it's a low flow device used in severe hypoxemia, allow for exhalation of CO2 and provide 80 to 95% FiO2 with 10 liter per minute. auto delivery system T-piece or T-shaped وحكينا عنه قبل شوي وممكن يعطي الفلوريت لحد 10 لتر per minute. It's a low flow device, normal respiratory rate and ventilation pattern. The high flow device for patient with high O2 requirement. يعني متى نستخدم اللو متى نستخدم الهاي. و the most preferred method for high concentration of oxygen is the mechanical ventilation. The complication of autotherapy, respiratory arrest, skin breakdown from mask contact, dry mucous membrane, epistaxis, or infection in the nares. Autotoxicity start for patient breathing concentration 50% more than 24 hours. يعني إذا المريض أخذ 50% FiO2 لأكثر من 24 ساعة احتمالية تصير في عنا autotoxicity. CO2 narcosis, which is characterized by confusion, headache among patients, especially with COPD, may result in increased PaCO2, hypoventilation, respiratory depression and arrest. Absorptive atelectasis, less nitrogen O2 mixture and increased somnolence اللي هو النعاس.